My day usually starts at 5:45 when my phlebos are on field. I've got a team size of more than 60 people, and whenever they are reaching the customer's location, they should always have that smiling face, they should always be well dressed, and they should always show that empathy while drawing the samples. While drawing the samples, they should always make it as painless as possible, because we get all kinds of clients, from small kids to elderly patients. So those who are already in pain, so we are serving those even kind of customers. So I have to make them as comfortable as possible. My name is Dr. Ankit Dwivedi. I handle the phlebo operations for North, and I am working as Regional Manager North Operations for the phlebo diagnostic team. I do come across quite a few queries, so where the customers do have really got some queries where they are asking about some particular test. They are not able to understand what their report means. But I could specifically recall one case where the customer personally called our call center team, and the call center team connected with me. So the customer wife was pregnant at that time, and he has booked the urine culture with us. So urine culture usually take 3 to 4 days, but in this case the urine culture reports were released after 5 days, because there was a bacterial growth was there. So customer was kind of worried what exactly is the scenario and why the report took 5 days, and was it something really to worry about. So when I spoke to him, I felt that urgency in his tone, and he was I could feel that he wanted to meet someone, so that a person who can make him understand that is not possible every time over a phone call. In healthcare, we always want that personal touch to happen. So immediately I had to cut short my vacation. I was able to reach there on time. The client was already kind of was worried, and I could understand, I could correlate, because I also have a kid. I can understand what a client was going through in his mind. So when I met him, I was able to solve all his queries. I told him about the entire process that we follow, and yes, being a healthcare company and being a doctor, we take utmost care with whatever kind of reports we are sharing with the client. We double check it if there is any kind of bacterial growth, as was the case with his wife's report. And that was the reason it took one extra day, because we wanted to be double sure whether the reports are coming, it was not a fluke and it's the thing, so that the treatment can be planned accordingly. So we had a good chat, and during a conversation, when he came to know I had to cut short my vacation, he was really surprised, and he really appreciated my efforts. But for me it was not an effort. For me it was something which came from inside, I should be able to help that person. That was a person who was worried about his wife, he was worried about his future son. So as a healthcare professional, as a dad, as a doctor, it is always my responsibility to make to help any person who has asked for help or he is worried. So I was really fortunate enough, it was me who was able to help that person, and I was able to bring that smile on that person's face.